Can screening asymptomatic individuals improve the detection of atrial fibrillation? What are the features of a successful fall prevention program for the elderly? Could a transplanted valve for congenital heart disease grow with a child? This and much more on today's JAMA Editor Summary. Hello, and welcome to our listeners around the world. Today is Friday, August 29th, 2025. I'm Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. For this episode, I'm joined by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti.
Hi, Kirsten. This week, the European Society of Cardiology Congress kicks off in Madrid, and we are delighted that JAMA will have multiple papers featured at the conference, including one that we'll start off with today. The Amalfi randomized clinical trial by Dr. Vijay Surendra and colleagues assessed whether screening for atrial fibrillation, or AFib, could improve long-term AFib detection. And of course, this is important since earlier diagnosis of AFib may help initiate anticoagulation use, reducing stroke caused by undetected AFib. The investigators randomly assigned more than 5,000 asymptomatic adults aged 65 and above at moderate to high risk of stroke to receive either a mailed, 2-week, patch-based, continuous electrocardiogram monitor or usual care. The primary outcome was the proportion of participants with AFib recorded in primary care records within 2.5 years. They found that this screening approach for AFib led to a modest long-term increase in AFib detection.
Yes, this is a really important study, and I can say the question is one that I, as a general internist, think about all the time. Although there was a modest increase in AFib detection, the rates of stroke were actually similar between the two groups. But I do think that because a patch to detect AFib is a commonly used approach for screening for AFib, this trial will certainly provide some evidence to help inform future research. I had a great time talking with our executive editor, Dr. Gregory Kerfman, about this trial. He spoke about the importance of this trial in an upcoming podcast devoted exclusively to ESC content published across the JAMA network. This is a bonus episode that you'll find here next week in the JAMA Editor Summary feed. Here's a sneak preview of the conversation.
The authors conclude that this kind of patch monitoring probably not a viable solution to reduce the rate of stroke in patients in primary care practices. We believed that this was an important negative study because this patch-based monitoring, remote monitoring for atrial fibrillation is receiving some attention. And we don't want to over-interpret what it may be capable of.
JAMA also published the Family Trial, a fall prevention program for older adults in rural China. Dr. Peng and colleagues created a fall prevention intervention aimed at adults 60 years and older who were at risk of falls. The intervention was integrated within the rural primary health care system and included balance and functional exercises and community-engaged health education. Investigators randomly assigned more than 2,600 participants to either the fall prevention program or health education alone. The primary outcome was the proportion of participants who reported a fall during the 12 months after the intervention. The prevention program was associated with a significant reduction of reported falls, with 30% of the intervention group experiencing a fall within 12 months, compared with 38% of the control group.
Yes, there's an accompanying editorial by Dr. Montero Adasso and colleagues that explains how trials like this, that investigate scalable models and programs specifically tailored to older adults, are important as populations continue to age worldwide.
We also heard from JAMA senior editor Dr. Karen Lasser, who was the reviewing editor for this trial. As a primary care physician and professor of community health science, she explains that falls among older adults are a major public health concern globally. She was excited about a primary care-based intervention that reported a reduction in self-reported falls. Dr. Lasser notes that health systems around the world can also learn from the trial's innovative use of village doctors who served as trusted cultural intermediaries, helping link rural populations in China to healthcare systems.
Yes, I appreciated hearing Dr. Lasser's helpful insights. There's also a pediatric case series this week in JAMA that focuses on partial heart transplant for congenital heart disease. The current treatment for valve replacement in infants is challenging because the replacement valve does not grow with the child. Dr. Overbay and colleagues collected data on 19 pediatric patients with congenital heart conditions like trunctus arteriosus and tetralogy of Fallot. These patients received a partial heart transplant using semilunar valves from donor hearts. The authors measured the growth and function of the transplanted valves with a median follow-up of 26 weeks and found that all valves had functional durability and demonstrated true tissue growth.
Dr. Daly provided a helpful editorial about the paper. He writes more about this innovative therapy and how partial heart transplant for treatment of congenital heart valve disease has opened a new pathway to utilize viable valves to better meet the needs of growing children.
Should we give an overview of JAMA Viewpoints this week, Preeti?
Sure. Dr. Jacobs and Booth write about how emerging federal limits on student loans could impact physician workforce diversity. JAMA has published a couple articles related to this important topic. And Drs. Bickett and Bateman write about long-term opioid therapy, reviewing known harms of overprescribing while noting the need to better understand whether and for whom these medications provide sustained benefit.
There's also a viewpoint by Dr. Chen about the important clinical indications for Mifepristone, reminding readers that this medication has uses beyond abortion.
Kirsten, you teamed up with JAMA Plus AI Editor-in-Chief Dr. Perlis and other members of the JAMA network on a piece about artificial intelligence in peer review.
Yeah, this is a really interesting article, and it was certainly interesting to think with my colleagues about the increasing use of AI that has affected so many fields and how it might affect publishing. We came together to think specifically about how the JAMA network can incorporate AI into peer review in a way that might aid the process while still maintain our high standards for accuracy, safety, and provide the type of effective input that we need for reviews of papers.
The JAMA clinical content this week has 2 cardiology-focused articles, just in time for the European Society of Cardiology meeting. There's a JAMA Insights by Dr. Osger on the management of tricuspid regurgitation. Meanwhile, you'll want to test your skills on this week's clinical challenge, which features fever, malaise, and weight loss in a patient with an aortic valve replacement.
Don't forget to brush up on your skin findings with the JAMA clinical review on cutaneous melanoma. Dr. Joshi and colleagues summarize the latest treatments for this common cancer. Tune in for the JAMA Clinical Reviews podcast with JAMA Deputy Editor Dr. Walter and the author of the review, Dr. Kirkwood.
And what % of melanoma would you say is hereditary?
So we think that up to 10% of melanoma can be heredity-driven or hereditary. Those patients who have a first-degree relative or more than one first-degree relative with a history of melanoma have this particular predisposition. The gene known as P16 or CDKN2A is associated with that risk and can be a basis for genetic counseling and for follow-up that differs for people who have this predisposition to melanoma from the general population.
Speaking of skin findings, there's a patient page this week on Lyme disease, an increasingly common tick-borne infection. This article reviews the typical erythema migrans rash and other signs of Lyme disease, as well as other helpful information about prevention and treatment.
Other cutaneous bites for clinicians and patients to be aware of, especially in the summer and early fall, are snake bites. There's another patient page this week that talks about venomous snakes, when to use antivenom, and more.
And before we wrap up, keep in mind the latest articles in clinical medicine, biomedical research, public health, and health policy, written and researched by our outstanding JAMA Medical News team at jamamedicalnews.com, or you can click on the link in the show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Daniel Morrow, Shelley Steffens, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.